brings us to what else is out there other than antidepressants. So if we go on, there's psychotherapy, which is basically if you talk, but there is transformative power of just talk. And studies have shown that psychotherapy is just as effective for all levels of depression to antidepressant medications, and particularly is more effective for individuals who suffer from depression because of an early childhood neglect or abuse. Okay, and it also has much higher ratings and is much more successful than antidepressants in reducing relapse. So if we go on to show a schematic model of CBT, or cognitive behavior therapy, which is probably the most effective type of therapy for depression. So I'm not going to go over this that much in the interest of time. Going on to the next slide. Again, research has shown that people improve with a combination of drugs and psychotherapy. So it's 1/3 to half of patients who suffer from depression don't respond well to either just the antidepressant or psychotherapy. So and if somebody's doing both antidepressants and psychotherapy, if we look at their brain, we actually see that when psychotherapy is successful and when antidepressants are successful, that they actually change the same parts of the brain. So it's as though changing your thoughts, whether it's through medications or psychotherapy, it's going to affect your brain chemistry. Going on to the next slide, and from this point on, I'm going to discuss treatments that are for very severe depression. Okay, that has not responded to antidepressants. We have what's called ACT, or electroconvulsive therapy, where you basically on purpose create or induce a seizure, and for some reasons that we don't know, that helps alleviate depression. How? We have no idea. If we go on to the next slide, also an electroconvulsive therapy. Now, this is something that the person has to go over many times, and you have a very high risk of relapse, so it doesn't treat depression. What else is out there? If we go on, very recently in literature, there's what's called repetitive TMS, repetitive transcranial magnetic stimulation, which is basically employing a very intense magnet to the scalp and almost resetting the brain. And this has been shown recently to be moderately effective for depression. This is not invasive, so it's not as cruel as electroconvulsive therapy. And to the best of my knowledge and the research out there, we don't think there's no bad side effects for this. Now, it's obviously very expensive, and it's probably not used widely yet, although probably it will in the near future. Okay, the next slide, which is probably the most invasive type of treatment for depression that has not responded to anything, just chronic refractory depression, is actually doing a brain surgery, disabling what's called the singular part of the brain, the anterior cingulotomy. Basically, you lesion that part, the anterior part. Again, why does it work? We have no idea. We just know that people who are depressed tend to show problems in that area, and that lesioning that area helps alleviate depression, in addition to other things like pain and obsessive compulsive disorder. If we go on to the next slide to look at additional treatment, I'm not going to go over the whole thing, but I want to highlight one, which is the deep brain stimulation. Is another invasive surgery where you implant almost a pacemaker in a part of the brain that continuously applies electrical stimulation. Okay, and last but not least, just like the treatment or the panacea for everything, if you will, is exercise. Regular, and I underline, non-strenuous exercise, I'm not talking about marathon running, that actually might be counterproductive, is actually recommended and shows increasing blood flow to the brain. If you remember earlier, I showed you on the brain and depression tends to show underactivation, and people who are active tend to be less depressed than people who are sedentary. Is it that exercise makes them less depressed, or is it that people who tend to exercise are just have the genetic equipment to make them not depressed? We don't know. Again, this is just correlation. So if we go on to the next slide, Okay, I just want to say thank you very much for your attention. And if you can go to my Facebook page and read some of the stuff that I post and like my page, I'd highly appreciate that. And I look forward to your questions and answers. So, Steve, you can take it from this point on.
Thank you very much, Dr. Marwa Azab. That was a fantastic presentation, and you can certainly see your breadth of knowledge that you have studied for many years. Now, we do have a couple of questions that have come, a couple that do have a similar vein as well, and so we'll go on to them. If anyone does have a question that they would like answered, you can still tweet us at Psych Webinars or post on our Facebook page. We've had a couple of email members email us in reply to our email list that have asked questions as well. So there's a couple of ways you can ask questions. Now I'll start with something that's come up quite often by the look of it is we'll go with Amanda's question, which is, do we know why 20%